I was like, was that what I think it was? Or am I just feeling gas? Because I have been feeling gassy since I found out that I was pregnant. Hey guys, welcome to my week 16 pregnancy vlog. I know I'm a little late. Today actually marks the beginning of my 17th week. Believe me when I say that things have been crazy, especially with school. It's really just kicking my butt. I am in my senior year in college, and it is just really tough, and I'm trying to get in as many classes as possible before the baby gets here, because I'm going to be back down to probably 2 or 3 classes in the spring, because it will be final exam time when the baby gets here. That's kind of scary to me, but then I will go one more semester and I will be graduating next fall, which is just crazy. I feel like my life is just flying before my eyes. I cannot believe that I'm getting ready, within a year to be graduating college, which is just nuts to me. But anyways, week 16. So week 16 was really good. It wasn't bad at all. Towards the end of the week, I did start having a little bit of heartburn, which could have just been attributed to what I was eating. I'm not really sure, what it was. It just would come out of nowhere, and it was just not a huge fan of it. But overall, the week was really good. At the beginning of the week, I was having some weird cramping or something, and it wasn't like the normal round ligament pain that I've talked about several times in several of my videos. It was just kind of like a weird kind of just crampy, sort of felt like my period was coming type thing. And I saw the doctor on Thursday, mentioned it to her, and she said that it was fine. I didn't really think that it was anything to worry about, because it really wasn't painful. It was just dull and achy, and it was just more than anything uncomfortable. That was pretty much it. One thing is, I did feel like maybe I felt the baby move at the beginning of the week. If you guys, I was raised, in the woods, pretty much. Not technically raised by wolves or anything, but I spent a lot of my time outside with animals as a child. And I don't know if you've ever caught a baby frog, but if you will catch them and hold them in your hand like this, they'll jump around, and that's the same feeling that I got in my lower belly. It was really fast. I was sitting down, Andrew had just gone to work, I was sitting in the recliner doing whatever, I don't even know, and all of a sudden I just felt it for 3 or 4 seconds, and then it was gone, and I have literally felt nothing since. But I was like, was that what I think it was, or am I just feeling gas? Because I have been feeling gassy since I found out that I was pregnant. So yeah, that was really cool. And even if it wasn't the baby, it just makes me really excited to know that, within the next few weeks, I will definitely be feeling him moving around in there, which is exciting. And yeah, it's just exciting. Week 16, the baby is the size of an avocado, and he is getting ready to enter a huge growth spurt phase where he is just growing like a weed, even though I feel like that's some major growth. Within 16 weeks to go from microscopic to avocado size is pretty huge. But yeah, so on Thursday, I had my doctor's appointment, and we went in and everything looked good. I have gained 8 pounds, which is crazy. I guess they want you to gain like 5 to 10 pounds is what she told me by this time. So I've gained 8, so I'm just, right in there. So she said that that was good. We heard the baby's heartbeat, which you heard at the beginning of the video, my little intro thing. I don't really know, but I love the sound. We talked to her about our concerns that I was kind of talking about in my last week's video, about the hepatitis B shot, about the erythromycin in the eye, just kind of going as naturally as possible. Discussed this for a while with her, and in my week 10 pregnancy video, there is a YouTuber named Eat Pray Crunch, and she is awesome. I love her videos. She commented on my week 10 pregnancy vlog and was telling me about going and looking into getting a midwife. So we decided to talk to the OB about that, and she gave us some good recommendations. So Thursday afternoon, after the doctor's appointment, I spent all day on the phone with Midwives, but I chose the office that we're going to be going to. And I spent, a good 45 minutes on the phone with this office, kind of discussing my desires, kind of discussing my plans for the labor and delivery, just sort of talking about everything that I'm interested in, what I want in a healthcare provider, just everything like that. And they just seemed really, really nice. They just seemed incredible. And there's only a handful of midwives that are in this office, and so I will be getting to know every single one of them. I have my first midwife appointment on Thursday this week, which is really, really exciting. And I'm just really excited to kind of look into this and hopefully switch over to them. And it's the same hospital. I actually have a choice between having the baby in a birthing center or in a hospital. And I just kind of feel like I still want to go the hospital route, just in case anything were to happen. I know that, the birthing center is literally like half a mile away from the hospital. But just in case my first baby, I would rather be in a hospital. But she did tell me that if everything goes great, myself as well as the baby should be discharged within 24 hours after the birth, which I thought was really cool, because I know that with my OB that I was looking at staying for probably about 48 hours after the birth, and I just kind of want to leave the hospital as soon as possible. I don't really want to stay there for any length of time, but so yeah, and so I have my appointment with them on Thursday, but we called at around just the right time because apparently on Tuesday, which is in 2 days, they are having a sort of event thing for, I don't really know who it's for. I guess it's for people who are interested in going to a midwife, or like new patients. I feel like I'm saying or a lot. I need to stop. Like, I just keep on hearing myself saying it. But so they're going to be having that event on Tuesday, and they're going to be serving food, which I love, so I will definitely be there. But you're supposed to be able to meet the midwives, and it's just kind of a social sort of thing rather than like medical, and just kind of discussing things and asking questions, and just supposed to be really cool. So we're going to be going to that on Tuesday night, which is pretty exciting. It's just really cool to be going through with the midwife thing. So to Eat, Pray, Crunch, definitely go check her out. Go run to her channel right now. She is awesome. She comments on literally every single one of my videos, and she always has like the best advice, and her son is just the cutest little thing ever, and she is just awesome. Thank you so much for that recommendation. Really, really excited to be going a more natural way, which I'm still going to be keeping it's in the same sort of system. So I think I'll still be able to keep my 20-week anatomy scan ultrasound. I think I'll still be able to keep that, which is scheduled for November 14th. I have been having this weird lower back pain, and it is the worst thing ever. It's just so uncomfortable. But besides that, week 16 has been great. Week 16 has been awesome. It's cool, that we're getting this opportunity to transfer over to a less to where you're going to get less intervention during the labor, to where they said, you know, one of their most important things is that unless it's 100% medically necessary, they will not induce you before 42 weeks, which I think is really cool, because I just want him to stay in there as long as he wants and as long as he needs, and I want him to come when he's ready to come, which isn't going to be for a while. But yeah, week 16, technically the very beginning of month 4. Really cool. This pregnancy is just flying by, and it is going great, and everything is just going super smoothly, and that's why I'm really glad that I'm not, at any type of risk, because I think that limits your opportunity to go see a midwife. Maybe, I'm not really sure. I might just be talking for no reason. But week 16 has been great, and I hope that everything out there for you guys is going wonderful as well. I try to watch all of your guys' videos. I just love the people, who are around the same time as me, like 12 to 20 weeks, 12 to 22 weeks, around that time. I just love looking back and seeing people talk about the same things that I was talking to. I'm sorry, this heartburn is killing me. But talking about, and then I like looking ahead and seeing what's to come, what's going on. I love seeing people's anatomy scans and things like that. So it's just really exciting. And that is pretty much it for week 16. So I know I had a picture at the beginning of the video, but I'm going to go ahead and show you my bump. And then I will go ahead and get off here before my chest catches on fire, because this heartburn, I'm telling you, it just like comes at random times, and it's just so strange. But anyways, this video is getting really long, so I will see you guys next week, or technically actually later this week, and I'm excited to sort of just update you guys and tell you about my midwife appointment and everything like that. So I will see you soon. Bye. So I'm just wearing just a regular t-shirt, and you can definitely see my bump through that. Now this is a week 16 bump, and I'm just gonna go ahead, and you can see how it's just so like weird shaped, how it's like, up here, and then it like gets huge down here. But this is it from the front, and then I feel like this line sort of thing looks darker than it has, but maybe that's just me, I don't know. And then from the side, and that is it. That is my week 16 bump.